Geriatric mental health tends to come on our agenda and then off our agenda over time.
It's perplexing to get old, I'm learning, even though I'm young when you talk to older people.
The aging population often thinks that they have to just accept how they're feeling.
When people are older and retiring, there's more space in their life. Now that space can be filled with either fear and anxiety or positive energy.
We become relatively less visible, and I think ageism is the last of the major isms in our culture.
One of the reasons why mental illness in the elderly becomes entrenched and so difficult to deal with is that the client gets no feedback from anybody.
One of the prime concerns that most people are challenged by is the isolation as one ages. And if one is not partnered, that becomes occasionally far more of an issue.
There's a tremendous amount of isolation in the elderly, and that's something again that is sort of a vicious cycle. I think the isolation and depression and helplessness, and so people oftentimes really spiral down.
If a doctor is treating a person and they disclose that they just have been crying maybe, or feeling like life doesn't really have as much meaning as it once did, it's very easy to write a prescription or to just say, well, that's just a natural part of the aging process.
I think there is a tendency to negate some of the serious mental health experiences that people have as they age, or to just attribute them to the aging process.
Oftentimes it's not necessarily expressed as depression or anxiety, and it's comes out in other behaviors or manifestations, and it may be compulsive shopping, or it may be a lot of physical complaints.
Maybe they're feeling that the joy in life seems to be less. Maybe they're feeling that they're more isolated than usual, but there's this acceptance amongst people that is just the way that they must live their life.
Extended family is either unaware or in denial about the client's situation.
For some people, they refuse to go anywhere else. I meet with pastor once a week, or I meet with pastor once a month, and if pastor isn't sensitive to the fact that maybe something's going on in your life that is mental health related, absent of divine intervention, your mental health goes neglected.
Someone who's older and has a mental health issue, maybe it's just depression and anxiety, which are pretty normal emotional states for people to be in when they're older. Where do you go? Obviously you go first to centers like Menorah Park or Jewish Family Services, or various places where they do work with the elderly, and they hopefully would have on their staff, especially with their mental health people or social workers, the names of professionals whom they could refer to.
In the past, I worked in a rural mental health clinic, and referred to me was a woman who was in her early 80s, and she was able to come in for treatment, and we met, and she really couldn't identify why she was there. She just knew that she was sleeping more than usual. She was there actually at the insistence of her primary care physician, who just really didn't know what to do anymore. They had tried a number of different medications. The two of them had tried to talk things out a little bit, but she was, her problems were persisting and her symptoms were actually worsening. And she had never been in therapy before in her entire life. She was very skeptical that it could have any kind of powerful impact in the way that she was feeling. And so we got to know each other a little bit over, a few sessions, and she started opening up and talking about the fact that she had been so lonely since her husband had passed, and that she had tried to talk to other people in her life about this just deep emptiness that was within. And we were able to strategize ways that she could maybe fill that through some activities with her church, reaching out to people that she knew and that she trusted. And I think really the biggest impact that our work had was just reassuring her that she was experiencing a very healthy set of emotions, and she just needed a very private place to put them.
We have a client that was referred to us through Project Reach, and this was a woman who was very isolated in her home and very anxious about getting out, and had some encounters with law enforcement, actually, which was a result of her anxiety. So we were able to get a therapist to meet with her in her home, and over time actually developed some plans for doing outings in the community, which were quite successful. They were baby steps, and the therapist was able to meet her at some public places and be able to help her with coping strategies to get there, and then also to deal with the public environment.
I can think of 2 residents that are presently with us that all residents are screened by an instrument called a patient review instrument. It's a PRI in our lingo. And one of the domains that they're screened in is behavioral. And both of these residents came up in that behavioral category. They had depression or depression with anxiety, and they were like a red flag. Like, if you take these people in, are you going to be able to manage them without difficulty? We took the risk. We brought them into our facility, and we immediately did interventions. We had consistent assignments, so their care providers were the same people every day, all shifts, and they became a little entity unto themselves.
In my recent depression, I felt sad, unhappy, hopeless, full of despair, and all the other synonyms for being so down that I couldn't see a way out. I did not want my life to continue if it had to be that way. It was not difficult for me to acknowledge my depressed state. I wanted help, and I reached out to everyone and anyone for help. I begged for help. I just didn't want to wake up another day of feeling so utterly low. The treatments included medicine, therapy, and counseling. I did have a medication on a patch that gave me an allergic reaction to its glue. The recommending doctor was insistent that I continue with it. It took quite a long time to get to the correct doctor. Thanks to a recommendation from a nurse practitioner, I started seeing Dr. Sharon Brangman. She was a lifesaver. Dr. Brangman was the first person to evaluate all the mini medications I was taking. She got me off several things that I no longer needed and were serving to make me loopy. She also made me believe there was hope that I would feel better again. Her treatment looked at everything. Now I can think clearly and advocate for myself. I have her permission to start driving. I'm willing to work hard to physically improve and get back to my previous life at home.
So if I had a wish list to kind of develop the most effective care and supports for seniors, I think at the top of the list would be continued efforts to destigmatize working with seniors within the behavioral health system, to encourage folks who are already delivering service to engage with seniors more effectively, to tailor their services toward seniors, and to engage students who are the up-and-coming deliverers of behavioral health services with regard to delivery to the senior population.
Well, in the best of all worlds, we would have a greater sense of community and a degree of heightened responsibility and accountability to one another and respect for other cultures, other ways of life, period. Optimally, realistically, I think that we are seeing that there are many shifts in culture and change, and I would like to believe that we could all be doing the best we can within that system.
I've seen it work. I've seen people go from a state-operated inpatient psychiatric hospital and move into a skilled nursing care facility with a really great behavior plan in place, where the staff have been educated as to how best to respond to this person and how to help them. I've seen it work, and I've seen the quality of life improve for a person who had very little hope that that would ever happen to them.
This is the time we got. live it. Don't bemoan it. Don't spend all your time regretting it. If there's regrets, what can I do now to bring more meaning into my life? What have I learned from my disappointments that I can still, cash in on now? What can I do now that's more creative, more fulfilling, more satisfying? So it's really, now it's time to start living again. And the question is, how do you do that? And that's what our mental health peoples need to help us do. Our mental health personnel needs to help older folks say, how can you start living again in a meaningful, involved way?